You're listening to the Health Courage Collective podcast, episode 21, Vitamin K. Welcome to the Health Courage Collective podcast, the show for women who are too busy to slog through hours of generalized, inapplicable, and often contradictory health information, but too smart to ignore that a few minutes of focused attention now can prevent years of suffering in the future. I'm your host, Christina Hackett, a pharmacist who doesn't want you to live on prescriptions, a certified coach specifically trained to maximize your potential, and a compulsive learner obsessed with preventative, cutting-edge, holistic, and integrative medicine. I'm on a mission to increase your physical and mental resilience so you can fearlessly look forward to your next 40-plus limitless years. Your time is now. Let's go. Hello, my friend. Welcome back. So good to be with you on this Thanksgiving Eve. I hope that you're doing great and finding time to relax this holiday season, even while you're working on taking tiny, uncomfortable steps forward that boost your authentic happiness. Today, as we always do, we're going to talk about one of my favorite things, vitamin K. If you remember 4 weeks ago, we talked about vitamin E and how it's pretty misunderstood. Vitamin K doesn't have as much of a controversy or mystery around it, and some people are starting to get wise to it. But the vast majority of people, including medical professionals, don't know as much as they should about its nuances and their potential for good. It can make a big difference, even possibly save your life. Vitamin K was discovered in the 1930s. It's named K because the German word for coagulation starts with a K. The first big thing you need to know is that there are two forms of vitamin K. K1, which is also the name of a go-kart racing place near me that my kids love, but that's not what we're talking about here, and K2, which is also the name for the second highest mountain on Earth. I just looked it up out of curiosity. It's on the border of Pakistan and China, and it's nicknamed the Savage Mountain. But that's not what we're talking about here either. K1 and K2. Unlike vitamin E, both forms were discovered in the 1930s. Vitamin K is a fat-soluble vitamin that is required to activate vitamin K-dependent proteins. There are 17 of these proteins that we know of so far, and they are located in bone, heart, blood vessels, etc. Vitamin K1 and K2 are structurally very similar, with K2 being a little less saturated with hydrogens, meaning it has a few more double bonds in its side chain. Sounds a little bit like our vitamin E discussion, right? Vitamin K1 is called phyloquinone and has hogged the vitamin K spotlight for the past 85 years. It's all people ever thought vitamin K was. A lot of people, including medical professionals, still do. But we're not normal, so I hope to convince you to hop aboard the K2 train with me today. It's been picking up steam for the past 5 years or so, which is a good thing. K1 phyloquinone is by far the most predominant form in the diet. You'll find it in all the green leafy vegetables, spinach, kale, collard greens, mustard greens, dandelion greens, all of them, and lower amounts in other green vegetables. Interestingly, it's a little higher in cooked green leafy vegetables than raw. I thought that was strange. Vitamin K1 promotes healthy blood clotting. There's a drug called Coumadin or warfarin that works by inhibiting vitamin K-dependent coagulation factor synthesis, and people who take Coumadin have to monitor their vitamin K consumption. Vitamin K is also given as a rescue in people who have overdosed with Coumadin. In the US, all babies born in the hospital are given a vitamin K shot right after birth to prevent a rare but potentially fatal bleeding around the brain due to vitamin K deficiency. Vitamin K deficiency is very rare, even more so in non-newborns, because the body recycles it and stores it in the liver and in fat stores. The main symptom of vitamin K deficiency is increased bleeding. You do need to have adequate vitamin K1 in your life. My kids used to watch this teenage motivational speaker kid named Caleb Maddox, and he always said, "We're not average, we're savage." And that was a good thing, to be savage. So if K2 is the savage mountain, maybe K2 can be the savage vitamin. What do you think? Will that express how cool it is, or just make people wonder if it causes barbarianism? Because it definitely doesn't do that. But you would endure a barbarian lifestyle better if you had enough vitamin K2 around. So maybe it fits? Vitamin K2 is called menaquinone. There are multiple forms of K2. They are abbreviated MK for menaquinone, even though quinone starts with a Q, so I'm not sure what that's all about. But there are MK4 through MK10. As far as we know, all the forms MK4, 5, 6, 7, 8, 9, and 10 are all equally beneficial to our health. MK4 and MK7 are all you really ever hear about, all that are studied, and all that are available as supplements. Vitamin K2 is super cool, yet overlooked and underappreciated. Sounds familiar, right? Vitamin K2 is much less common in our diet, and we don't recycle it and store it in our body like we do with K1. You can become deficient in K2 in as little as 7 days if your diet is deficient. Most people in Western societies are deficient in K2. K2 is not found in green vegetables. It is mostly produced by bacteria. MK4 is a short-chain form, mainly found in dairy foods like butter, ghee, milk, and some cheeses. Grass-fed dairy and meat is always better for you. I love my Kerrygold grass-fed butter. There is also K2 in pasture-raised organ meats like liver and a little bit in pastured eggs. A very small amount can be formed in your body by converting up to 5% of dietary K1 into MK4 K2. MK7 is a long-chain form of K2, primarily found in fermented foods like cheeses, kefir, sauerkraut, and natto. A small amount can be produced by the bacteria in your GI tract. I've been meaning to try natto for a few years now because I know how good it is for you. I've heard it tastes just like eating boogers, so for that reason, I've just been taking K2 as a supplement this whole time, but maybe I'll get brave and give it a try just to let you know what I think. I'm not sure what I'd put it on. I'm not a fan of soy in general, so I'll see if I can find any organic natto. If you haven't heard of it before, natto is fermented soybean paste. The fermentation process makes glutamic acid polymers which can stretch up to 8 feet long. The longer it stretches, the better the natto. In addition to vitamin K2, the enzyme nattokinase in natto paste is really good for you and your cardiovascular health. Natto has the most dietary K2. Next after that is pastured goose liver. Next would be Gouda and then Brie. There is one kind of blue cheese that has it, but you have to know exactly which bacterial strain they used in the making of the blue cheese because there are all kinds of different ones used. Okay, so why do I love vitamin K2 so much? What does it do? It doesn't participate in blood clotting the way K1 does. The main thing K2 does is to tell calcium where to go. Why does this matter? I remember in the early 2000s when I was in pharmacy school and for several years after I graduated, calcium was a big deal. You thought health was chewing chocolate-flavored Viactive calcium chews. There was much ado about oyster shell calcium versus calcium citrate, and everyone was recommending that women, especially older women, take 1,200 milligrams of calcium 2 to 3 times a day. We thought that would prevent a whole generation of women from getting osteoporosis. At that time, we had a calcaneus heel bone DEXA scanner at my pharmacy. So not like the full body DEXA scans, it just went in your heel. But it showed my bone density when I was 21 years old as that of an average 70-year-old woman. I already drank a ton of milk, but I started taking calcium once a day too because of that. I thought this was the one and only way to increase my bone density. Over the years, it became more and more apparent that loading up on calcium alone is not a safe thing to do. People started experiencing deadly problems. Do you remember how I keep saying that nutrients are not solo acts? They all need to be in balance for things to work. It's very important that calcium be in balance with potassium and magnesium. Most Americans are deficient in magnesium. Vitamin D is required for proper calcium absorption, and our savage vitamin, vitamin K2, is required for calcium to go to the right places. We absolutely need calcium in our bodies, especially in our teeth and our bones. Getting a lot of calcium into your body without proper balance and direction causes calcium to deposit in places like your coronary and carotid arteries. It can also cause kidney stones, heel spurs, breast tissue calcifications, heart valve deposits, and more. You definitely don't want calcifications where they don't belong. You can actually get a calcium scan of your arteries to check if you have this if you want to. So, with a lot of calcium running around, you start to get these scary deposits even while your bones and teeth continue to lose calcium, getting weak and holey in the case of dental cavities. You lose the calcium from where you want it, and you gain it where you don't. Enter vitamin K2. When given the right nutrients in the right balance, your body can thrive. With the right amount of vitamin K2, vitamin D, and magnesium around, calcium goes to your bones and teeth and stays out of your arteries and other places that you don't want it. For real. Vitamin K2 activates a vitamin K-dependent protein called matrix GLA, a protein that inhibits calcium from entering soft tissues like arterial walls. Studies have shown that K2 protects against cardiovascular disease and hospitalizations. It reduces calcification of coronary arteries and lowers the risk of death from coronary heart disease. Studies have shown that increased K2 actually lowers the risk of death from any cause. Vitamin K2 improves bone quality and strength, reducing risk of osteoporosis and fractures. It activates a vitamin K-dependent protein called osteocalcin, which promotes bone formation. Studies have shown it to reduce bone loss and fracture risk in postmenopausal women. I've heard some naturopaths say that it's possible that tooth temperature sensitivity is exclusively a vitamin K2 deficiency problem. Maybe so, but even if not, it definitely plays a big role in tooth sensitivity. If your teeth are sensitive to temperature, it's possible that you need more vitamin K2, not more fluoride. Tooth strength and health improves with more vitamin K2. K2 may also have some antimicrobial properties, specifically in the mouth. Part of a longer discussion, but it is possible to remineralize your teeth rather than get your cavities drilled and filled. It takes an expert and orchestration of consistent effort, but it can be done, which I think is pretty awesome. Activation of osteocalcin also helps with glucose homeostasis, which stimulates healthy insulin and adiponectin expression. Insulin is a hormone that controls so much. It's not just about blood sugar. That's its main job, but high insulin is a major problem for your body, even if your blood sugar levels are still normal. Most people, including medical practitioners, don't care about your insulin level until your blood sugar is off. We're not normal, so we care about this, but we'll have to discuss more about it later. Adiponectin is a hormone that protects against developing insulin resistance and type 2 diabetes. Studies have shown that vitamin D3 and K2 together produce higher insulin sensitivity, and this lower insulin resistance improves PCOS symptoms and also decreases triglycerides and VLDL cholesterol. Improving glucose and lipid metabolism is hugely important, and it makes sense that because of this correlation, studies have shown decreased abdominal fat in postmenopausal women who take vitamin K2. Vitamins K1 and K2 both reduce inflammation. This is a big deal. We want to keep our chronic inflammation low, and we live in a very inflammatory society, so it's hard to do these days. K2 inhibits the release of pro-inflammatory cytokines by the immune system and reduces markers of oxidative stress that accelerate aging. Reducing inflammation promotes brain health. Do you remember that many conditions like Alzheimer's, Parkinson's, even anxiety and depression are related to inflammation in the brain? K2 is not the only piece, but it can be a helpful piece of the puzzle. MK4 is the predominant form of K2 in the brain. It helps in the production of sphingolipids, a group of complex fat molecules that are components of cell membranes and the nervous system. People with Alzheimer's and Parkinson's have been shown to have reduced levels of K2 and harmful changes to their sphingolipid metabolism. Vitamin D acts a little more like a hormone than a vitamin, and it does a lot of great things. You definitely want adequate levels of vitamin D in your body all the time. You remember from a few weeks ago that vitamin D is super important in order for your immune system to be up to par. It's also anti-inflammatory on its own, and it helps with calcium absorption. You can't absorb your calcium in your GI tract if you don't have enough vitamin D in your system, and it won't go where you want it to go without vitamin K2. This synergy of vitamins D3 and K2 is important in all the ways K2 is important in your body. Vitamin K2 activates these different vitamin K dependent proteins, but vitamin D is essential in the expression of those proteins so they can actually do what they're supposed to do. Studies show that vitamin D and K2 together is better than either one is alone for improving bone mineral density. They are also better together for heart health, showing better decreases in atherosclerosis together than either is alone. As a fat-soluble vitamin, it's possible to overdose on vitamin D, which causes high calcium levels, nausea, vomiting, frequent urination, and kidney problems. There is a naturopathic doctor named Dr. Kate Remu Blue, I think she's Canadian but French, who wrote a book about vitamin K2, and she says that vitamin D toxicity is actually caused by induced deficiency of vitamin K2, or an imbalance between D and K. So if you had enough K2 around, you would never overdose on vitamin D. I didn't know that before. Vitamin A also plays a role in this little dance because vitamin A has a vitamin K2 sparing effect. So does D. So excess D can't cause K2 to go down as much if there's enough vitamin A present. So interesting how it all works together. Vitamin K2 and magnesium also appear to work together, but we're not sure the exact mechanism yet. Vitamin K2 is also really important in pregnancy, childhood, and adolescence. We won't go off on the tangent of helping your child's face, jaw, and mouth form properly so they don't have to get braces down the line, but it can be done, and K2 can assist with that. But it's really important in teenagers too, because their nutrient need goes up as their skeleton starts to grow very rapidly. We want their bones to have all the nutrients they need to grow quickly and be strong. Vitamin K2 deficiency is super common in adults, but even more so in adolescents, which isn't a surprise given that most teenagers don't eat a lot of fermented foods, goose livers, or brie. I haven't been giving my kids K2 in the past, but I'm going to start at least a couple times a week because their skeletons are definitely growing rapidly. I have a picture of my family on my desk at work that seems like it was just taken the other day. It was actually like 2.5 years ago. My oldest boy comes up to about my chin in the picture. He's taller than I am now and quite happy about it, so K2 in adolescence and early adulthood is a good thing to get that skeleton started out strong. It's easier to maintain bone strength than to try to build it out of weakness. I've mentioned before that I've been getting a DEXA scan once a year for the past 3 years to check up on my body fat percentage, lean muscle mass, muscle symmetry balance, and bone mineral density. My bone density is crazy high, like way beyond the 99th percentile. My last scan was a few months ago and she was like, I didn't think it was possible for your bone density to go up, but it did a little bit. She said I'm the poster child for skeletal strength, which made me feel good. I've got a lot of areas to improve on, but bone density isn't one of them. My hand surgeon told me that my bones were stronger than anyone he's ever operated on before, which is a lot of people, and he could really feel it as he was trying to screw all those screws into them. If you remember, this was not the case when I was 20 years younger and drinking way more milk and taking calcium supplements. I rarely take calcium anymore. I take K2 and magnesium and boron and some other good stuff, but I think the drastic difference is from K2 and from the fact that I fell in love with barbells about 6 years ago and truly enjoy picking up heavy stuff. I'm nobody special, so I know if you are consistent about weight-bearing exercises and getting enough vitamin K2, you can be osteoporosis proof too. There are other things we can discuss in the future too that help your bone strength, like other nutrients and, of course, hormones. If you don't want to consistently eat organic natto and goose livers, there are vitamin K2 supplements. We don't know if it makes a difference whether you do just MK4 or MK7. Getting either one is better than nothing. I try to take them both just for fun. Because it's a fat-soluble nutrient, it's probably better absorbed with food that has some fat, so like taking it at meal times is best. As far as I know, it's a pretty straightforward nutrient to make and take, So you don't need to find any kind of crazy formulation like you do with some supplements like glutathione or curcumin. As long as it's a company you trust to actually put in what they say they do and not use harmful fillers or binders, you're good to go. A typical daily dose of the MK7 form of K2 is 100 to 200 micrograms a day. A typical daily dose of the MK4 form of K2 is 10,000 to 45,000 micrograms a day. So the dose you take depends on whether you're getting MK4 or MK7. Most of the studies use about 180 micrograms of MK7. If you were to eat one serving of natto per day, you'd get about 350 micrograms of MK7. I'll put some links in the show notes to some supplements. As always, none of them are affiliate links. Buy whatever you feel good about. I'm agnostic. I have taken K2 supplements from Costco in the past. I take Pure Encapsulation's Synergy K now because that's what we have at my pharmacy. Carlson Labs, who I like, also has a K2 supplement, and Life Extension Foundation that I also like has several different vitamin K2 supplements. You decide what's best for you, but unless you regularly eat natto or goose liver, I would highly encourage you to consider adding vitamin K2 to the supplements you take. Thank you so much for taking the time to be here with me today and learning some tips that will help you live healthier for longer and possibly avoid prescription medications down the road. Next week, we're going to talk about brain indigestion. Until then, don't be normal. Thank you so much for tuning into the Health Courage Collective podcast. I am truly honored that you have paid me the enormous compliment of your time and attention. I would be so grateful if you would share this podcast with someone you know and subscribe so you never miss an episode. This podcast is for entertainment and information purposes only. Statements and views on this podcast are not medical advice. This podcast, including Christina Hackett and producers, disclaim responsibility for any possible adverse events by use of information contained herein. If you think you have a medical problem, consult a licensed